Examine 5 days? Chill. In the next few minutes, you'll lock the types of surveillance and know exactly how they look for malaria and HIV in India. These concepts are classic short notes and VIVA favorites, forming the backbone of outbreak detection and program monitoring. One question here can fetch you easy marks, making this topic crucial for your exams. Surveillance is the ongoing, systematic collection, analysis, interpretation, and dissemination of health data for action. Think of it simply as see, think, act. This systematic approach drives public health interventions. Now, let's dive into the big buckets of surveillance, easily remembered with the mnemonic PASSEL. P stands for passive surveillance, which relies on routine reports from health facilities. A is for active surveillance, where health staff actively seek out cases. S is for Sentinel surveillance, utilizing selected sites for high-quality trend monitoring. The second S represents Syndromic surveillance, tracking symptoms before lab confirmation for early warnings. Finally, L is for laboratory-based surveillance, involving systematic lab reporting, often integrated with other types. Remember the Integrated Disease Surveillance Program, or IDSP, in India, our umbrella early warning and response system. Now, let's see how these types of surveillance look specifically for malaria. The National Vector-Borne Disease Control Program, NVBDCP, oversees malaria surveillance. Key measures to mention in any answer include API, ABER, SPR, and SFR. For passive surveillance in malaria, OPDs, PHCs, and CHCs send weekly line lists of fever cases. These cases are tested by RDT or microscopy, with positive cases reported upward, driving local action. Active surveillance involves fever surveys by field workers through house-to-house visits, especially in high-risk areas. The objective is early diagnosis and complete treatment, with blood smear or RDT within 24 hours of fever. Sentinel surveillance for malaria uses selected hospitals and medical colleges to monitor severe malaria and treatment failures. This helps track complications and signals for drug efficacy. Under IDSP, Syndromic surveillance for malaria identifies clustering of fever with chills alerts, triggering rapid response. Lab-based elements include microscopy QA from designated labs and periodic cross-checking of smears. PCR is used in reference settings for species confirmation and epidemiology. Now, let's shift our focus to HIV and how these surveillance types apply. The National AIDS Control Organization, NACO, manages HIV surveillance, emphasizing second-generation surveillance. Sentinel surveillance is the star for HIV in India, conducted at selected sites to measure trends. This includes ANC clinics for the general population proxy and HRG sites for high-risk groups. Passive or case-based surveillance involves routine data from ICTC, PPTCT, and ART centers. This includes new diagnoses, linkage to ART, and viral load testing, with increasingly deduplicated reporting. Behavioral surveillance, part of second generation, uses IBBS-type surveys. These surveys assess condom use, needle sharing, and testing uptake, interpreted alongside prevalence to understand transmission dynamics. Syndromic surveillance in the HIV context uses STI and RTI syndromic caseloads as early warnings. Spikes in these caseloads prompt targeted interventions in high-risk groups. Lab-based elements include national reference labs ensuring ELISA and rapid test QA. They also handle early infant diagnosis, viral load testing, and early warning indicators for drug resistance. Let's quickly review the key exam points and mnemonics to ace your preparation. Remember PASSEL, passive, active, Sentinel, Syndromic, and lab-based surveillance. For malaria, always quote API, ABER, SPR, and SFR. HIV surveillance prioritize Sentinel surveillance, especially ANC and HRG sites, supported by case-based program data and behavioral surveys. IDSP keywords include weekly reporting, zero reporting, early warning signals, and rapid response teams. Memorize the action loop. Detect early, verify quickly, respond fast, and feedback back to field. To recap, surveillance is continuous and action-oriented, crucial for public health. For malaria, passive means facility reports, active means fever surveys, Sentinel covers severe cases, Syndromic tracks fever clusters, and labs handle microscopy QA. For HIV, Sentinel focuses on ANC and HRG trends, passive uses ICTC antiretroviral therapy centers data, behavioral involves IBBS, Syndromic monitors STI loads, and labs manage EID, VL, and QA. If a 6-marker question pops up, open with Parcel, then drop India program examples. Examiners love the linkage from type to action to indicator. Bas ho gaya. You've got this. If you found this episode helpful, don't forget to like, share, and subscribe to the channel for more high-yield made school content.